My name is Dr. Hopp, Robert Hopp. I'm a dermatologist here in Kennewick, Washington at the Center for Excellence in Dermatology. And I've created a video list of informational videos for my patients, covering subjects all the way from shave biopsies to melanoma to sunscreens and everything in between. They're short, informational videos of what I tell my patients and their instructional drawings that I've included that I think help patients understand uh, the subject that's being talked about. So I would encourage you to take advantage of these.
This video is on shave biopsy of the skin. Shave biopsy of the skin is a very common technique used to remove lesions or areas on the skin that are very superficial. Its advantages are that it is quick, easy to perform, and doesn't require any wound care other than changing a Band-Aid. There's no sutures, and it's a commonly used technique in a dermatology office. So the very outer layer of skin, the epidermis, is really just the thickness of a piece of paper. The dermis, the next layer down, and then subcutaneous fat. So if you have typically a mole or some other area of interest that you want to sample to see if it's malignant or not, you can put on some topical numbing cream ahead of time to numb the area up, and then you use some lidocaine through a needle in a syringe and inject the area. And what that does is it raises up the area of interest on a little bleb of numbing medicine and makes it easier to remove. So after it's anesthetized, which is very rapid, a double-edged razor is used to remove the area and gives a specimen that is very thin and superficial but contains the area of interest. In this case, say the mole, the melanocytes of a mole, or a nevus as it's called, and that will be sent to the laboratory for analysis to look at underneath a microscope, and that leaves a thin area of epidermis where the lesion has been removed from, which will heal in on its own from the side, usually about 7 to 10 days. And the only wound care that's generally required is topical antibiotic and a new Band-Aid once a day, and cleaning with hydrogen peroxide. So a simple technique, quick, relatively painless, and is very useful for superficial lesions.